If I had to start studying for the VTNE all over again, I would do it completely differently. Because most people aren't struggling just because they're not smart enough. They're struggling because they're studying the wrong way. My name's Amy. I'm a licensed veterinary technician, and I spend a lot of time training assistants and technicians in practice. So I see where a lot of people get stuck all the time. If you're studying for the VTNE or just trying to actually understand this stuff better in clinic, this video is for you. One of the biggest things that I see is people trying to study everything equally. They're reading textbooks, highlighting, rewatching lectures, and it feels like they're putting in the time, but nothing's actually sticking. And then when it comes to time to actually apply it, whether that's on a test or in clinic, it just doesn't click. And that's frustrating because it starts to feel like maybe I'm not good at this, or maybe I'm just bad at medical math, or maybe I just can't remember anything. And most of the time, that's not the problem. The problem is that veterinary medicine is very application based, but most people are studying like it's memorization based. So you end up with all of this information in your head, but no real way to use it or to access it. The biggest shift that I would make if I had to start all over again would be this. I wouldn't focus on memorizing everything. I would focus on understanding how things work. Because if you understand the why behind something, you can usually figure out your way through questions, even if you've never seen the material before. And that's what the VTNE is really testing. It's not just, do you recognize this term or this structure? It's, do you understand what is happening with this patient? And can you make a decision based on that information? So instead of asking, how do I memorize this? I would start asking yourself, what is this actually doing? And why does this matter? If I had limited time, which most people do, I would focus on high yield areas first. So your medical math, pharmacology, anesthesia, and basic lab interpretation. Those four alone cover a huge portion of what you'll see on the VTNE. Not because those things are the only things that matter, but because they show up over and over and over again, both on the test and in real life. And instead of just reading about them, I would actually practice them, especially with medical math. Medical math is just one of those things where you can feel like you understand it until you actually try to do it. And then everything just kind of falls apart. So instead of just watching somebody try to solve a problem and trying to understand it from them, or just looking at an answer, you actually need to sit down and work through the problem yourself. Even if it's super slow, even if it's really messy, even if you get it wrong the first few times, that's how those type of topics start to click. And for things like pharmacology or anesthesia, I would stop trying to memorize every single drug or every single number, because that's where people get overwhelmed really, really fast. Instead, I would simplify it. I would ask myself a couple of things. So I would start with thinking, what does this drug do? What is it used for? And what should I be watching for in my patient? So to give you an example of that, is this drug a sedative? Is it for pain? Does it affect heart rate? Does it affect blood pressure? That level of understanding, especially in pharmacology, is far more useful than trying to memorize a long list of details. And it's a lot more applicable for you, and it's a lot easier to consume. There are also a few things that I would avoid completely. I wouldn't just reread notes over and over again and just hope that it sticks. I wouldn't spend all of my time on topics that I already feel comfortable with just because it's easier. And I definitely wouldn't ignore my areas that feel harder or more confusing, because those harder areas, they're usually the ones that make the biggest difference in both passing the test and actually functioning in a clinic. And this is where I think a lot of people get stuck. So I want to give you a real example of what this looks like. Let's say you're studying pharmacology. A lot of people will try to memorize a huge long drug list. So they'll sit there and they'll try to remember the name, the dose, the side effects, and all of these tiny details, which is great in theory, but in practice, it's not always that easy. It can be really overwhelming really, really fast. But instead, if you shift how you think about it, let's say you're looking at a drug like dexmedetomidine, so dexdomitor. Instead of trying to memorize everything about this medication, everything about this drug, let's start with the basics. What is it doing? It's a sedative. What does it do? It causes vasostriction. It can lower our heart rate. Okay, well, that already tells you a lot. So if you see a question or if you're in clinic, you can start thinking through it. You can take that information and understand if this drug lowers the heart rate, what kind of patient might that be a problem in? If this causes vasoconstriction, what might I expect to see with blood pressure? And that's how you start connecting the dots. And the same thing applies to medical math. Instead of just memorizing formulas, think about what you're actually solving and what you're actually solving for. So if you're calculating out a dose, you're just figuring out how much drug this patient needs based on their weight. That's it. But when you simplify it like that, it becomes a lot less intimidating if you just think of it through with batch structure. And that's the difference between feeling like you're constantly guessing and actually understanding what you're doing. If I had 1 or 2 hours a day to study, I would break it up like this. I would do about 20 to 30 minutes of medical math practice, because that's a very important area to understand. About 20 to 30 minutes reviewing core concepts, and then 20 to 30 minutes applying it, whether that's just practice questions or thinking through different scenarios in your head. So for example, you would say, if this patient had these symptoms, what would I expect to see? Or if I'm giving this drug, what should I be monitoring? That way you're not just taking in information, you're actually learning how to use it. And that's the piece that most people are missing, because at the end of the day, this isn't just about passing a test. It's about walking into a clinic and actually understanding what's going on with your patients and feeling confident in what you're doing. And that confidence comes from understanding, not memorization. So if you're studying for the VTNE or there's something that you keep getting stuck on, please comment down below and let me know. I'll start making more of these videos, breaking down topics in a way that actually makes sense in practice. Follow along for more information and more study tips.